I remember once going to see a patient, the house staff said that she simply had asthma. And we went to see her and she did indeed have asthma, but what had been missing from the story is that this was around the mid-September. She had lived in New York, and on September 11th, she was in the World Trade Tower when the planes hit. And every year, as September 11th came by, her mild asthma would get much worse. It was this part of her story that was really behind the exacerbation of her asthma. And if you didn't know that, you couldn't help make her really better.
When a physician treats a patient as if they are a generic patient, as if they were like every other patient they've seen, they're at great risk of making mistakes. The only way to address that gap is to get to know that patient.
To you a little bit earlier, and I couldn't find that many pictures, and I'll try to look for some more, but we were talking about the little bag that they use.
There's really no reason why doctors in training should have to have so many patients to take care of so quickly.
And this is the gallbladder, and then they sort of like pull it out through a hole.
And so we decided that we would reduce the number of patients on one of our inpatient services.
The idea is that we have them rotate on the Aliki service. They learn how to get to know their patients very well. They learn the important aspects of transitions of care. They can do that in a slower pace so that when they're back in the faster paced environment, they hopefully will carry some of those things over and do a better job.
Aliki simply gives you the opportunity to be a better doctor.
Hi, I'm Ryan Childers. I'm one of the internal medicine interns here, and most of the year we have a lot of patients, have limited time to really get to know the patients in some circumstances. So that's really what's great about Aliki. We get the chance to really explore kind of the personal lives of patients. And so one thing we like to do is present, kind of go over the details of your story here at the bedside, how that affects their conditions, how that might affect how they do once they leave the hospital.
It gives you the opportunity to practice and be the kind of doctor you hoped you could be. So I was excited about the opportunity to do that, and we knew, at least for a few weeks a year.
It also gives us as medical students more time to sort of go through the labs, their presenting symptoms, and sort of get to understand also the disease process that they've presented with a little bit better.
We're spending more time at the chalkboard talking about the pathophysiology of disease. How does a certain medical condition develop? What are the risk factors? How can we impact on it? What is the science behind what we're learning?
The home visits have turned out to probably be the richest part of the experience so far, or at least it's the part that's most unique to the resident. Now this is an opportunity to learn if you got the answers to the test right.
Hi, Mrs. Ball. It's good to see you again.
Usually you don't ever learn that in the hospital. You do the best you can to take care of them. You discharge them and hope that they do well. Here we get to find out, well, yes, they did get better on the antibiotic, or no, they didn't. It turns out it wasn't pneumonia after all, it was heart failure.
So these are both of your pill boxes? This one is the morning.
The physicians that visited me today treated me like I was a human being. They were concerned about my welfare. And if some of the doctors that I have run across would take a few lessons from them, I think the whole world would be a lot better off.
We do tape those home visits so that we can use the experience to then teach other house staff. I think the one theme that really has come out over and over again is people realize that patients very commonly, when they leave the hospital, don't take what we think they're going to take.
I'm confused.
I understand, because you have a lot.
How many times do you take this one a day?
That's correct. Once a day.
It should be twice a day.
I'll try to stretch it out. It's expensive.
The most pressing healthcare crisis on the horizon for the U.S. right now is the management of chronic illness. And that's really what's driving healthcare costs today. Illnesses that require long-term management on the part of the patient.
When you say better and cheaper in the national healthcare debate, now you got people's attention. And I think that Aliki is not a fancy schmancy new gizmo that can diagnose cancer. It's a way of being a doctor that I think will catch on, and I'm hoping will also have important effects on health outcomes and on a health economy.
There is an aha moment that goes when a resident or medical student has the opportunity to interact with a patient and see how important it is to that patient, but also to experience for themselves how rewarding it is as a physician.
You know, it gives us time to be able to do right by a patient, and, you know, to get that gratitude from a patient is really enforcing and informing how I personally want to practice in the future.
A simple phone call to the patient or family once they've left the hospital means a tremendous amount to them. I think sometimes you can pick up on a few things that you can let someone else know about to make sure something's not falling through the cracks.
People began using the name Aliki to define good doctoring.
It takes, as you would imagine, some resources in order to do this.
Good morning, Mr. Johnson.
As we try to teach residents and interns and medical students things, we need to actually pay for the time for the teachers to teach that, to develop curricula, and we actually need to teach our teachers how to teach.
The Aliki Initiative shows how powerful philanthropy is and what a difference one person can make. And that's really the history of medicine, and it's the history of Johns Hopkins, that a person can have good ideas, but it's only through support of the public, largely through philanthropy, that those ideas take off.
The support of Mrs. Perroti allowed us to jumpstart and initiate an important program that, at its minimum, has galvanized the members of our healthcare team and created an excitement around the importance of patient-centered care.
This needs constant gardening from everybody. It needs gardening from professors who are going to teach it. It needs the gardening of people who are entering this field, and it needs the attention of the public, because this won't happen, this won't continue. This never could have begun without the support of the public. This is one of our greatest flowers. We can't let it die.